Every life is precious, and sudden cardiac death, which can affect people of different age groups, is a major concern all over the world. In India, the number of sudden cardiac deaths has escalated due to rapid changes in lifestyle and food choices, which is why it's crucial to be prepared. Worldwide, millions of people die of sudden cardiac arrest every year, and that's partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation or CPR. Many adults in cardiac arrest can be revived if they get immediate and correct CPR, and raising public awareness and understanding of CPR is an essential strategy. It's perhaps even more important to know about CPR if you have a loved one who has a history of cardiac disease. Well, this program, Save a Life, is an initiative through which people are going to be made aware of the early signs and symptoms of cardiac arrest so that patients can get to hospital in time and also be trained in giving CPR. Well, as always, we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. Joining us today, Dr. Arindam Pandey, Senior Consultant, Cardiology Services of the Medica Super Speciality Hospital in Kolkata. Dr. Dilip Kumar, Director, Cath Lab, Medica Super Speciality Hospital, Kolkata, and Dr. Pritesh Ashok Pawar, Consultant Interventional Cardiologist with the Yashodhara Super Speciality Hospital in Sholapur. My first question is to Dr. Pandey. Dr. Pandey, heart disease obviously refers to multiple conditions that affect a person's heart and cardiovascular system. So what are the different types of heart disease, and which one specifically can lead to sudden cardiac arrest? Dr. Pandey.
Yes, so there actually can be different types of heart disease in the form of congenital heart disease, which actually presents since birth. Then there is something called ischemic heart disease or coronary artery disease. Then there is hypertensive heart disease, valvular heart disease. Some of them are cardiomyopathy, heart failure. But out of all these different types of heart disease, it is the ischemic heart disease or coronary artery disease, which is most common nowadays, prevalent in adult people, and actually they are the main cause behind the sudden cardiac death and cardiac arrest.
Right. Thanks for that response. Dr. Pandey, if I can also bring in Dr. Kumar, the term festival cardiac syndrome is currently causing concern. What does this mean given the fact that we are in festival time right now? Also, there is a general sense of celebration and being out there after 2 years of the lockdown when everyone has been so confined. So what is this festival syndrome?
So thank you, Ankita, for asking this very, very pertinent and relevant question, particularly at this point of time. We have been fortunately out of pandemic, and there is a tendency to meet and greet people. And during the festivities and festival season, this becomes more and more, common. And this is not only a known entity, but it's a very, very common entity, festive cardiac syndrome, or what we call holiday heart syndrome, where we see a lot of patients coming to our emergency department with complaints of racing heart or giddiness or sometimes shortness of breath. And it all happens because we take more food that is more fatty in nature, more salt, and especially, one important thing, people tend to booze also, and it causes kind of arrhythmia, which is called as atrial fibrillation. So this is a perfect platform to make everyone aware that this kind of problems happen, and sometimes it can turn in a wrong direction also. So we have to celebrate festivals, but it has to be a composed way, and we have to control ourselves. We are greeting and meeting people and going out for parties.
Right. A timely reminder, specifically when there are so many such gatherings happening as we speak. Dr. Pawar, are symptoms of heart attack and cardiac arrest the same? Do the symptoms change for women as compared to men?
Yeah, symptoms of heart attack and cardiac arrest, these are all two different scenarios. Heart attack we mean when there is a sudden occlusion of a coronary artery, patient develops chest discomfort, and then we get sometimes usually. Right. But when it is basically a sudden cardiac arrest, people fall down, a person fall down and suddenly it becomes, unconscious, and there is a loss of breathing, he is not breathing, and then we need an immediate CPR.
All right. So, Dr. Pandey, if I can ask you, why do some people get cardiac arrests in their sleep? Are there any symptoms which can help them to identify this risk?
Yeah, this is a very particular question actually. So, why we must understand why cardiac arrest happens. So, what is cardiac arrest basically? Cardiac arrest is something. So, heart stops working, and most common cause of cardiac arrest actually are cardiac arrhythmia. So, there is some problem in the electrical circuit or some issue in the electrical circuit of the heart. So, actually, there is some arrhythmia which causes heart to stop. Now, it has been seen that many a time this cardiac arrhythmia, they may actually occur during the sleep spells. And there is a particular disease known as obstructive sleep apnea. As you all know, Bappi Lahiri recently, he died out of this condition. So obstructive sleep apnea, this can also lead to some cardiac arrhythmia. As a result of that, there can be cardiac arrest during sleep. So how you're going to rectify, how do you know that you are having this kind of disease? So you need to go to your physician. There will be some simple tests in the form of some ECG, Holter monitoring, and if there is suspicion that you might be suffering from obstructive sleep apnea, there is something called polysomnography or sleep study. And this is not very, unusual investigation. It is available widespread. You need to undergo this investigation, and if these issues are found out, actually you can rectify, because there are specific treatments which are available for these situations.
Right. We will take a very quick break at this point and try and fix that line to him, and be back in just a moment. Welcome back to Save a Life, Health and Wellness. We're talking to eminent cardiologists today about the need and the importance of CPR and how best to administer it in cases of sudden cardiac arrest. Dr. Pawar, if I can ask you, are symptoms of heart attack and cardiac arrest the same? Do the symptoms change for women as compared to men?
Good afternoon. The heart attack is one of the important cause of cardiac arrest. When we say patient has suffered a heart attack, we mean that patient has acute sudden reduction in the supply of blood
to the heart muscles. It may be total obstruction or very critical reduction in the blood supply to heart muscle that has caused heart attack. The symptoms of heart attack are chest pain. Usually the chest pain is central. It radiates towards the left shoulder, left arm. And symptoms of heart attack, the chest pain is continuous, and pain can be from umbilicus to your belly button. There are other symptoms like shortness of breath, loss of consciousness, palpitations, vomiting, nausea, and feeling of unwell. Many times heart attack is the cause of cardiac arrest, and cardiac arrest is said to be present when we have three conditions. Number one, patient is unresponsive. Number two, there is no normal breathing, and number three, there is no pulse felt. As asked whether the symptoms are same, in women many times the symptoms are atypical. They present with abdominal pain, back pain, nausea, vomiting, and because of this atypical presentation, the diagnosis of heart disease in women are late.
Right. Dr. Kumar, how can we help someone who's experiencing a heart attack or sudden cardiac arrest? What are the ways in which there can be interventions?
Yeah, I think it's very important issue what you have raised. How can we help? So this is an opportunity for everyone to become a saver, and this is a proven fact that if a bystander starts CPR, just chest compressions, it does increase the odds of survival of the patient. And if you see someone dropping down and in front of your eyes and he's not responding, he's not breathing, just raise an alarm. Call up the nearby hospital, or any emergency number, and don't wait for anything. Start chest compressions, CPR, 100 to 120 beats per minute. You have to just give compressions. It should be hard and fast enough to go 2 inches down, and should be in the middle of the chest on the sternum bone between two nipples. So this is the place where you can go for CPR. And this is a very important fact. Each 1 minute you lose for giving a CPR, you are going to reduce the chance of survival by 10%. So with this estimate, you can say in 10 minutes time, the survival of patient is absolutely zero. So you have to start as early as possible. And coming to heart attack, you ask anyone who is having chest discomfort. If someone tells you has chest discomfort, which is a kind of central pain, but Dr. Pawar just described, radiating to arm and the jaws, and he's sweating. So it's most probably it is because of heart attack. And you ask that person to take a aspirin, he can chew it, and also a statin tablet. And sometimes if someone has sorbitol. So with these three important small steps,
right,
you can save these patients as well.
Yes, Dr. Kumar, emphasizing really how little sometimes time there is for an intervention, so how crucial it is to know when to intervene and to do it right. Dr. Pawar, which brings me to my next question. Lack of CPR awareness is obviously a big health challenge. So, if you could really break it down for us in steps, exactly what is required. Dr. Pritesh Ashok Pawar?
Yeah, lack of awareness is very common. Out of hospital cardiac arrest is very common. If everyone knows how to do basic life support, that is how to give CPR, we can save lot of life. The acronym which I usually tell is doctors CAB, DRSCAB. First D is for danger. Look the scene, whether it is safe for you, for the person who is unresponsive, who has fallen into cardiac arrest, and the bystanders. R is response. Check immediately the response. How you are going to check? You have to tap on the shoulder and ask the person, are you okay? If he is unresponsive, immediately you have to check for the central pulse. So central pulse is the carotid pulse. Usually how we check is, this is the windpipe and there is a muscle laterally. So we keep our two fingers here and we check for the central pulse. So if pulse is felt or not, that should be checked, and immediately breathing, whether the patient is breathing or not, that has to be checked. This has to be done within 10 seconds. And immediately you should shout for help. You should, bystanders should be taken and they should be asked to call for emergency medical help. And second thing is, if you are in airport, railway station, or you are in mall, there is availability of AED, that is automatic external defibrillator. So ask somebody to get that defibrillator. And now the main important step is to do chest compression. C is for chest compression. This is the most important step, and it should be started as soon as possible once you know that patient is in cardiac arrest. Chest compression should be given at the nipple line and should be placed one hand. The heel should be placed over the chest. The other hand should be placed over the first hand, and it should be interlocked. Your elbow should be straight and your whole body pressure should fall from shoulder straight to the heels. And the chest compression should start. Chest compression should be given by 100 to 120 per minute, and chest compression should be given such that it goes up to the depth of 5 centimeter or 2 inches. This is very important. You should not do interruptions in the chest compression. Second thing is, what important is airway. When the patient falls, the tongue of the patient goes backward, and so their air cannot go inside the lungs. So we have to do head tilt. This is head. You have to tilt it, and you have to chin lift. So you have to lift the chin so that the tongue is taken out of the airway, and the air can go inside the patient's windpipe. And the third step is breathing. And here you can use a pocket mask, and you have to give breathing. And the compression to ventilation ratio is 30:2. Very important is, you have to continue the CPR until the help arrives, and you have to give it at the ratio of 30:2.
Right. So, Dr. Pandey, a follow-up question to this: when should one stop giving CPR? Also, are there certain situations when CPR should not be given at all, Dr. Pandey?
Yes, so this is very relevant. So once you started doing CPR, so you are trying to save the life of the patient. So if you get some significant information that the patient has, gone back to life, that means there are signs of life, then you can stop CPR. So patients start talking, or everything sensorium improves, or like that. Or it may so happen that you got a help, because already Dr. Pawar said, whenever you are starting CPR, you should also ask for some additional help. Say for example, by this time the paramedical staff or ambulance arrive and they can take care of the patient, then you should stop doing CPR. They will now take the handover. Now, if you are giving CPR for very long and the patient is not responding, you should try to check a very simple thing, the body temperature of the patient. If the body temperature of the patient is very cold, that means the patient has already died. So there is no reason to continue CPR after 10-20 minutes if the patient has already died. So that is something you should check. There are other way you can check the signs of life in this patient. There are important ways. You can check the pupillary reflex. You can check the corneal test, but those are actually not feasible for the common people or layman to do. So simply just checking the temperature of the body can be sufficient. Now coming back to your second part of the question, when you are not supposed to start CPR, that is also very important. Now if the patient has already died, then you are not supposed to start CPR. So there are some signs of life you need to check, and commonest way, we just tap the shoulder, ask the patient whether he's responding. But if the patient has already died long before, the temperature of the body will be very low. You are not supposed to start CPR in those cases. Similarly, if you are not in a position to continue CPR, say for example in the middle of the road, or the patient has devastated body, in those situations also you are not supposed to start CPR. Now it can happen in other way. If the patient is already admitted, then many cases there is something called DNAR. So that means do not resuscitate. Those situations, actually some other countries, they have more formulated policy for this kind of situation, when the patient's underlying condition or the illness is so bad that actually you cannot offer any definitive treatment. In those situations, there are some formulated policy, government policy, which says that if the family person and if the patient is awake, they can take mutual agreement that we are not going to resuscitate. In those situations, you may not start CPR in a dying patient. And in our country, there is lack of government policy, but it is actually a matter of mutual understanding in between the patient's relative, the physician, as well as patient, if he is actually awake.
Right.
Then if they decide, then also we can decide not to resuscitate the patient.
Right. Actually, that's a very important point you raise. And if I could bring in Dr. Dilip Kumar to sort of discuss that further, what really are the legal ramifications of giving CPR in India? Is it legal? Who can administer it? Are there any rules regarding it? Should people hesitate at all to give CPR in times of need?
A very, very important point. I think there is a lot of misconception and fear. A person has if they feel that they will have to face lawsuit if a patient dies. But this is absolutely, there's no need to worry. This is entirely legal from Indian guidelines, and rather you deserve appreciation, and you can save a life. And there is a term called good Samaritan law. In this broad category of laws, it is included. And so there is a complete legal impunity, and rather you will be liable for more and more appreciations. You will be a lifesaver. You will be considered as a hero if in the end of the day the patient survives.
Right. Dr. Pawar, to sort of move away from this, but under the broader ambit of what we are discussing, prevention is, of course, always better than cure. So, how does one keep one's heart healthy so that it doesn't get to a point where CPR is necessary, especially during the festive season when we're all kind of eating more, drinking more than we should, perhaps?
Yeah, this is very important, as all of us know that prevention is better than cure. And how to keep your heart healthy, I would like to say A, B, C, D, E, F principle. It is easy to remember. A is addictions. So addictions such as alcohol, tobacco, smoking, cocaine addictions. If you have any of the addictions, you should stop such addictions. B is for blood pressure. If you have blood pressure, then you should take proper medications, and you should proper healthy lifestyle should be followed so that your blood pressure should be in control. Second B is body mass index. So body mass index should be less than 25. We know now obesity is growing concern, and if we will keep our body mass index to less than 25, chances of getting heart diseases will be less. C is cholesterol. We have to keep our cholesterol in the normal range, because cholesterol is the factor which deposits in the interior layer of the artery, and it causes obstruction of the artery and causes heart attack. D is diabetes. Diabetes, as all of us know, is very common disease, and now we have got lot of diabetes patient in India. Diabetes patients, 70% of them die because of cardiac elements. So proper nutrition, proper exercise, and proper medication should be taken so that your blood sugar should be kept in control. E is exercise. Physical exercise is very important. FIT principle is what we follow when we tell about exercise. F is frequency. How much you should do is frequency is 5 times a week. I is intensity. Intensity is moderate intensity exercise you should do, such like brisk walking. T is time. For how much time? Is 30 minutes, 5 weeks a day, and moderate intensity exercise. So this is the principle fit which everyone should remember and everyone should follow. And last is
Right.
F. F is family history. If you have a family history of your parent or grandparent suffering from cardiac disease, then you should get yourself screened for blood pressure. You should screen your blood sugar and you should screen your blood cholesterol levels. If you follow this A, B, C, D, E, F principle, then I think your heart will remain very healthy. Thank you.
All right. That's a good note to end the show on as well. Doctors, thank you very much indeed for this special edition of Save a Life, where we talk about what to do and what not to do, especially during this festival season. Thank you all for watching.